cannabis plant has been used as a drug for various traditional medicines for centuries, but its abuse among young people constitutes a major public health issue. 28-year-old Mary Jane, not her real name, shares her experience of grappling with a 15-year-long addiction to cannabis. She tells me that her involvement in using cannabis began shortly after the loss of her mother. Faced with family pressures during the vulnerable period, Mary Jane succumbed to the influence of friends who introduced her to smoking weed as a way to alleviate her anxiety.
I started smoking after the demise of my mother.
She admits that being an addict does not bring her joy and desires to break free. However, she finds it challenging to go a day without smoking, as the absence of it makes it difficult for her to eat or sleep.
I cannot do anything if I go a day without weed.
Experts maintain that the use of these substances has far-reaching negative implications for users, one that threatens their growth and survival.
It's a psychoactive substance, so yes, it may temporarily seem to give you certain benefits, but in the long term, its effects are detrimental to you. There's a system called the endocannabinoid system, and the THC, the tetrahydrocannabinol, which is a component of the cannabis, can easily bind to those receptors to help perform the function that they perform in the brain. But THC, or tetrahydrocannabinol, it sticks to the receptors for long as compared to the natural substance in the body. So it then produces this benefit that people may seem to have, but then because of its long-term effect, it then has detrimental effects on the brain and then on the person.
Some individuals who have been using marijuana say they continue to face struggles and challenges. They wish they had led healthier lives.
I've been smoking for 16 years, so trust me, I've been addicted to it. Yeah, because smoking, if you get addicted to it within 3 months, if you take it constantly. Before you start smoking, my friend, I swear, trust me, make sure you save a lot of money. Because honestly, you are lost. Every smoker regrets smoking.
Other individuals who use cannabis claim they become euphoric and have no intention of quitting anytime soon.
Happiness. I started smoking due to influence from friends. I get so happy when I smoke.
Because
I have never regretted involving myself in this act. It is not a sin. Some people like alcohol and others like we. We smokers live longer than drunkards. Drugs energizes me to perform well. I am a laborer and I work hard anytime I use drugs.
Besides alcohol and tobacco, cannabis is one of the most common substances used globally among the general population, with about 147 million people representing 2.5% of the world population engaged in cannabis consumption on an annual basis. That's according to the WHO. In Ghana, there is a 5.3% prevalence of cannabis use among individuals aged 11 to 19 years old. Mary Jane is optimistic that there will be a time when she will cease smoking.
Small, she no koni ani fear. Ni oni kewe. Kajiboni mami bueni.
Despite the challenges, there is hope. Treatment centers and support networks are available to those seeking help. Dr. Maalug Yennusom has been helping users overcome their addictions for the past few decades.
If the pattern of use is that of dependence or addiction, like you are saying, then the person would need rehabilitation. And the rehabilitation can be inpatient or outpatient. That are the services we actually provide at the Brain and Sleep Medical Center, and that means that it needs professional treatment. If the pattern of use is just abuse, which is the person using, there are behavioral issues or problems, but then the person is not dependent or addicted to it, then you just need some form of therapy that we call motivational interview, helps the person to get through. So with respect to the rehabilitation, we take you through series of sessions in which we help you to eventually live independent of their cannabis.
He highlights some factors that increase the person's addiction potential.
Individual factors like the person's biological or personal factors. So if there's an inherited predisposition to it, then also it could just be that the person might be going through certain mental health issues and is using the cannabis to get some relief from it. Anxiety, stress, depression. We can also have interpersonal factors like the person's relationship with people. Peer influence.
While the fight against drug